Hello, everyone. I'm back. This is Gianji. If you are watching my video for the first time, I want to say welcome. For those of you who have been following me, thank you so much for your support. So this week, one of the disease focus for this week is on stroke awareness. So today I am going to be discussing stroke and just giving you some advice on what to do if you are around somebody, or even if it's yourself, that may be having symptoms that looks like it could be a stroke. So we all know stroke is very common in our community as Africans, and just everywhere, every population, as a whole. And stroke can happen to anybody at any time of any age. Someone as young as 9 years old can experience a stroke event. And what causes stroke is a blood clot that develops in your body somewhere and travels to your brain and block the flow of blood to the part of your brain. Now, I did a video, or in-depth video on stroke. So if you want more detail, you can check out my YouTube page, which is Health Talk with John J. And just look for the video that I did on stroke. It was a PowerPoint presentation where I talk about the risk factor for stroke, what causes stroke, the two types of strokes, because it's important to know the different type of strokes, and then how each of them is treated. Right? So the other medical name for stroke is cerebral vascular accident, or you'll hear a medical professional referring to it as CVA. C like cat, V like Victor, A as in apple. Okay, so and also if you are living with chronic high blood pressure that is poorly managed, that can put you at risk for getting a stroke. When I mean poorly managed, that means your blood pressure is consistently high, extremely high, and it's poorly managed. So that can put you at risk for developing a stroke. So stroke is a very serious disease, a very serious condition that can happen, and if care is not taken, if you do not know how to recognize the signs and symptoms of a stroke, if you are having it, or if you are around somebody who may be exhibiting some of the symptoms of stroke, it's important that you act fast, because every minute counts when stroke strikes. Okay, so today I'm going to be sharing with you how to check or how to recognize the signs of a stroke. So in order to spot the signs of a stroke, there's an acronym that is used, which is FAST, F-A-S-T. So each letter represents something. It's very, easy to remember. So if you are near someone, and you think that, oh, this person may be having a stroke, you want to ask them to smile. Okay? So ask them to smile. If in the process of them smiling, you notice that one side of their mouth is drooping and the other one is, raised, the other side is maintaining the smile, but the other side of it is drooping, that's one indication that that person may be having a stroke. So you ask them to smile, and then next you want to ask them to stretch out their hands. So if they stretch or raise their both arms at the same time, and you notice one of their arms, they can't keep it up, it just flops down, that's another indication that that person may be having a stroke. Then you want to ask them to speak. So in the process of them speaking, if their speech becomes slur, that you can't even understand the words they are saying, that's an indication of a stroke. So what do? You want to act fast. Do not delay. Now, the person may have all of the symptoms. They may not have all of them. They may have one or the other. If even one of those symptoms are present, call 911 immediately. get them to your nearest emergency room, because timing for a stroke is very crucial. It will save that person's life, and it will also save them from becoming paralyzed in the process, which is called residual effects of a stroke. Okay, so you get them to the call 911 immediately. They will do a CAT scan of their head or the brain to determine what type of stroke it is. If it's a bleeding stroke, which is called a hemorrhagic stroke, or if it's a ischemic stroke. Okay, depending on the stroke, they will know how to treat it. All right, but the key thing I want to point out is knowing how to recognize the symptoms of a stroke and what to do. So the key is to act fast and get them to the nearest emergency room. My daughter is crying. She's about to run in this room, so I have to go. Bye. I hope this was helpful. And check out my YouTube channel on Health Talk with John J for more information on stroke. Bye.